I wanted to introduce you what's going on in Ethiopia and at Hospice Ethiopia. So now, my direction to my organization is to working as a full time, but taking care very much. We're providing sanitizers, face masks, these soaps and stuff like that for our staffs. And we don't greet each other, even if at Hospice Ethiopia we do. We do face mask in the workplace as well, and we wash our hands. We use frequently sanitizers, so that we have to work. Otherwise, it is very, very, very difficult. Yeah, of course, we didn't stop seeing our patients even during that hot time in the country, and even during the time the government said no, stay at home for 2 weeks for their public institutions. But we continue to see our patients because they are patients. We have to see them. We have to care for them. Well, I would say one of the impacts of coronavirus is for us at Hospice Ethiopia is we are not able to stretch or implement as per our plan this year. Our plan was like to have expansion at least two areas at Hawassa and Mekelle. And in Addis Ababa, we have also had a plan to increase the number of new patients we see this year, because we have recruited one more nurse for that matter. But now even patients are not very much willing to come to seek and get the treatment at Hospice Ethiopia, because they don't want to travel. One. Secondly, I think it is globally, I have heard in the UK as well, the health seeking behavior has been reduced because people have got fear to go to healthcare facility. You see what I mean? Yeah. So because of that, now the number of patients coming to Hospice Ethiopia for the outpatient care clinic is reduced. But for the home care as well, it's not. The hospitals are not also referring patients for us, because they are directed to coronavirus, to get prepared to see patients, stuff like that. So these things affected our home care program as well. Anyways, but now we are trying to initiate even our partners like hospitals and caregivers for them to send patients to us, so that we can see them in their home. Secondly, we have decided at least to start the expansion plan at Hawassa. Yeah, there are some activities we would like to do when we have expansion program, like we did in Bahada. One of the activities is providing training for healthcare providers. So that nurses, those nurses and doctors trained in palliative care can provide the service to their patients. That is the first thing, because there is no training, there is no knowledge about palliative care, so people cannot give the care service for their patients. That is one of our objectives. Secondly, Hospice Ethiopia, in collaboration with Hawassa Referral Hospital, will provide home-based care. We will initiate. They don't have home-based care so far. So Hospice Ethiopia will assign a nurse to that expansion site, and the nurse will liaise the activities between the community and the hospital. And the nurse will also be responsible to see patients together with the doctor at the hospital. So thirdly, we will try to make the hospital as a model for the surrounding the town, or for the other hospitals, because this hospital is the referral hospital for the region, for southern nation region. There are other hospitals as well, public hospitals. So if we can make it this hospital a model, the other healthcare facilities can learn from them, and they can, take this care to their community. So in their hospital, patients who are admitted in the hospital will have access for palliative care. Like, Hospice Ethiopia is a kind of center of excellence for the country, you see. So we would like to bring the same or more or less the same kind of quality of care in Hawassa, so that, a patient at home will have like holistic care, like we give in Addis Ababa. So that is what we would like to do actually regarding the expansion of our program.
That sounds fantastic, and I know the donors that we've got involved, that they were sort of very excited about that idea.